Hello, grade 10, and welcome to your first revision worksheet of semester 4. It is within the theme of technology and technological innovation. It is called Selfie medication. Phone apps push people to take their pills. Let's see how that works. Read the below text that highlights the use of Selfie to monitor the medication of old and sick people, then answer the questions that follow. Seattle, of course, is the capital of the state of Washington, which is in northwest US. Take 2 tablets and a selfie. Your doctor's orders may one day include a smartphone video to make sure you took your medicine. Smartphone apps that monitor, meaning supervise, pill taking are now available, and researchers are testing how well they work when medication matters. Experts praise the efficiency, but some say the technology raises privacy and data security concerns, of course, as always. So this new app or these new apps in the smartphone make sure that people are actually taking their medication. Okay, Selfie medicine works like this. Open an app on your phone, show your pill, put them in your mouth and swallow. Don't forget to show your empty mouth to the camera to prove today's dose is on its way. Then upload the video proof to the clinic. Fans say that technology addresses a big problem. About half drugs for chronic conditions aren't taken as prescribed because of cost, side effects, or patient forgetfulness. Of course, this would be very practical for elderly patients or patients who are getting treated for drug abuse. Are they really taking their medication at home? Well, you're going to have to take a selfie showing the doctor or your healthcare provider that you really have taken this medication. With treatment for opioid addiction, again a type of drug addiction, skipping a dose could mean or can mean a dangerous relapse. You go back to your old problemed self. The National Institute on Drug Abuse is funding research to tailor a smartphone app for those patients and see if they'll use it. If we can keep patients engaged, we can keep them in treatment longer. Okay. Paragraph 4. At one Tennessee treatment center, some patients with opioid addiction are already using the app to upload selfies of their daily dose and answer questions about how they're doing. Every time they sign on or sign in, it allows us to capture data. Are they having cravings, suicidal tendencies? Said Scott Olson, CEO of Dallas-based Pathway Healthcare, which is trying the app at its Jackson, Tennessee site. Maybe a phone call from a counselor might make the difference between staying clean, of course clean out of drugs, and a relapse, meaning going back to drugs. Olson thinks insurers will pay for the service with more evidence. For monitoring tuberculosis patients, of course, tuberculosis is a highly infectious airborne disease located in the respiratory system, symptomized by a lot of coughing, and its problem is that it is contagious. For monitoring tuberculosis patients, health departments pay roughly $35 to $50 per patient each month for systems that include encrypted data storage. A small health department might pay as little as $500 a month. The idea of watching someone take their medicine, called directly observed therapy, has roots in tuberculosis, where one person's forgetfulness can be serious for everyone. Of course, if they don't take their medications, as it says here, if patients don't take all their antibiotics, their infectious, meaning contagious, TB, tuberculosis germs can get stronger, developing drug resistance and endangering the broader community. But taking a handful of pills daily for up to a year is difficult, so public health departments traditionally sent workers to people's homes and workplaces to watch them take their doses. Today, many TB patients prefer remote monitoring. Remote means from far, through their phone. Nurses like it too. They don't have to go face to face with the patient and get maybe infected. For instance, here they're given an example of this. Nurse Peggy Cooley has used Skype for years to chat live with patients taking TB medicine. We can accomplish in a 2-minute phone call something that might have taken an hour to do, and most of that hour was in the car, said Cooley, who works for the Tacoma Pierce County Health Department in Washington State. The new uploaded selfies don't need an appointment. They are a daily routine for many tuberculosis patients in Seattle, San Francisco, Los Angeles, and Houston, where savings on mileage and worker time amounted to $100,000 in recent year. See the simple phone app, how much time and money it's saving? Okay, instead of health workers driving, wasting time, wasting fuel, wasting energy, they would do this remotely through a phone. In Boston, Albuquerque, and 5 other cities, researchers are studying whether the technology works for hepatitis C, another very contagious disease that's bloodborne, that's surging among a new generation of injection drug users. New drugs for hepatitis C can cure, but they're expensive. $75,000 for a 12-week course of treatment, so insurers want to make sure patients take them. Insurance company is the party paying for it, or maybe the government is paying for it. They want to make sure what they're paying for is getting taken or getting used properly. I think it holds a lot of promise, and researcher Dr. Elaine Litwin of University of South Carolina School of Medicine, who's testing whether patients do better when someone watches them take their pills. What's next? An insurer, of course a person who has or works for an insurance company in Maryland, plans to use the technology in diabetes and high blood pressure to make sure Medicaid and Medicare patients take their medicine. Those, of course, health care insurers in the US, they pay the bill for health care. Startups selling the app say they could be used by faraway adult children monitoring an elderly parent's daily pill taking. Okay, you can't be, of course, this is especially practical now during quarantine. You can't be with your mother or father or grandparents, but you want to make sure that they took their medicine. You can monitor them through such a phone app. Experts worry about privacy, data security, and penalties for poor pill taking. That's the biggest ick factor, said Caroline Newhouse, a medical ethicist, a moralist, at the Hastings Center in New York. You can imagine a program where benefits are tied to compliance, and the insurer says, we won't pay for medication anymore unless you're taking it correctly. Globally, the spread of smartphones creates an opportunity to eradicate TB. Eradicate means wipe out, the app developers say. But eradicating TB may take simpler, cheaper technologies that can be scaled for millions of cases, said Dr. Daniel Chin, who leads TB efforts for the Bill Daily Pill, then calls the revealed number. Worldwide, TB kills more than 1.6 million people annually, yearly, even though most deaths are preventable with treatment. If we are going to eliminate the disease, we need technology, said Dr. Richard Garfield of the University of California, San Diego School of Medicine, who helped develop one of the smartphone apps, Sure Adhere. Okay, now let's take a look at the questions in part B. Answer each of the following questions in complete sentences. What function does paragraph 2 serve in relation to the first paragraph? Explain. Let's take a look at the first paragraph, the introduction, where the author presents an interesting fact. Take 2 tablets and a selfie. Your doctor's orders may one day include a smartphone video to make sure you took your medicine. Okay? And then paragraph 2 starts with selfie medicine works like this. Open an app on your phone, show your pills, put them in your mouth and swallow. Okay, here it introduces the concept of selfie medication. Here it explains it, it defines it. So of course, Paragraph 2 here serves as a supporting paragraph in relation to the first paragraph. It elaborates, meaning it explains, okay, the idea introduced in the first paragraph about selfie medicine. It shows readers how this technique works, okay? So it's idea elaboration. Now identify 3 purposes other than to inform the writer might have behind reading this text. Of course, one purpose is to show facts. There are many facts about selfie medicine and about the diseases that this technique can help patients live with, such as TB or tuberculosis. Another purpose is to prove that the application is effective. The writer shows that it is not time-consuming, nor does it cost any money. On the contrary, it saves both money and time. One more purpose is to teach readers a lesson about the great value of technology. How technology nowadays seems to be a savior, saving time, saving money, and saving lives, of course. It functions as a soul protector if it is used in the right way. Identify the tone revealed in paragraph 10. How does it change in paragraph 11? Here, paragraph 10. Where do we get the tone from? Of course, it's written as an adjective and it's taken from the choice of words the author uses. It shows his or her attitude. I think it holds a lot of promise. So this is first keyword, promise. You know, it's promising, it's optimistic, said researcher Dr. Elaine Litwin. Okay. What's next? An insurer in Maryland plans to use the technology in diabetes and high blood pressure to make sure Medicaid and Medicare patients take their medicine. So again, something that's effective, something that is promising, something that is positive. And then paragraph 11 starts with experts worry about privacy. So here the tone changes to a bit of worrying, critical, skeptical, okay? That's the biggest ick factor. So there's a downside to it. You can imagine a program where benefits are tied to compliance and the insurer says, we won't pay for medication anymore unless you're taking it correctly. So the tone here in paragraph 10 can be described as promising and optimistic, as we said. The paragraph highlights the promising effect of this technology has with diabetes and high blood pressure. In paragraph 11, there is a shift in tone. There is a tone of worry. Some experts have worries about some harms that the technology might reveal, such as privacy, data security, and penalties for poor pill taking. Okay, you were observing this patient and he didn't take it properly. What happens? Let's sue you. Okay, so this is what worries here. Okay, pick out from the indicated paragraphs, going back to the paragraphs, a cause-effect signal, of course, because. A time order signal then. Other time order signals might be one day, later on, after that. Anything that is related to time, things happening in a chronological order or in a time order. After that, later on, 1995, etc. A contrast signal, we find but in paragraph 10. Of course, other contrast signals, however, nevertheless, okay? An exemplification signal, exemplification showing example, for instance. Okay. Now you need to go back to paragraph 7 and 10, which I displayed here in order to fill in the cause-effect chart. Using technology in diabetes and high blood pressure, why? What are the effects? To make sure patients take their medicine. The effect to monitor parents' daily pill taking. Use the application by faraway adult children, the children of those parents. Okay. Sending workers to people's homes and workplaces to watch them take their doses. Okay, extract A. Other insurers might be asked to pay much more depending on the quality of service they offer, but with a more accurate evidence. Okay, we have to take a look at all the paragraphs, and after we figure out the main idea of each paragraph, we put the main idea in a phrase next to it. Okay, we figured that extract A is the correct ending of paragraph 5 because why? It's thematic. It's talking about the costs of this type of technology. Extract B, in other situations, Cooley added. Where did they talk about Nurse Cooley? Okay, we spent one whole day to reach a patient, and that's only to be sure that she got the medication. Where were they talking about Nurse Cooley? The example they gave, paragraph 8. So extract B is the correct ending of paragraph 8. Okay, moving on, match each of the following words, bold typed in the text, with its synonyms. Okay, they were pretty easy. Skipping their medication, omitting. Okay, monitoring means supervising, watching, observing. Okay, surging, going up, increasing. Okay, sweeping, moving. Eliminating, of course, means excluding, getting rid of something. Okay, so this is it for your worksheet. Please make sure you write down any questions which you might have for me. Okay, and see you